My name is Dr David Perez and I'm the chairman of the Clinical Leadership Group for the hospital redevelopment. You may think that the hospital is mainly about bricks and mortar, but in fact a very important component is the people, the staff, not only doctors, nurses, physiotherapists, but also everyone who contributes to the hospital running well. The Clinical Leadership Group is here to ensure that the voice of staff is heard well so that we can provide the best service for patients and also a nice working environment which works to the advantage of both staff and patients. Who are we? We're 25 fairly senior members of the organisation and we're all clinicians with years of hands-on experience. We all recognise that health is evolving all the time and that this new hospital is a once-in-a-generation opportunity to change the way we do things for the benefit of patients. So while our job is to give advice to the DHB concerning clinical policy, we also have to look into the future, perhaps 20 years distant, to make sure that patients will get the best care. You might notice that I'm standing in the hospital museum with some quite fascinating instruments behind me. These were useful in the past, but are definitely not recommended for the future. We will take them to the new hospital for interest, but we have to ensure that the equipment there is going to give the very best service to patients over the next 1 to 2 decades. So what might the new hospital look like in 25 years? It's very hard to make predictions, but we're doing our very best to make educated estimates. We have some very lively discussions and try to think of future needs and how we can best equip the hospital to meet these. So far the Clinical Leadership Group has had discussions on a wide range of topics, and for example these have included the best care for the elderly, the best design of wards and the digital hospital, which means the best use of modern electronic equipment. We have made clear recommendations to the DHB concerning these services, but we've also set out to provoke wide-ranging discussion among staff so that they have a broad vision for the future which will deliver the best quality patient care.